Alright, I am doing my long-awaited nursing assessment video, and I'm going to be using one of my dog's toys for my baby. I've kind of set up an elevated crib-like platform, and I'm going to jump right in with the vitals. I'm going to listen to the apical pulse of the baby's heart, and you want to listen for a full minute. Move it around to all 5 parts of the heart. And then you're listening for abnormal sounds and also keeping track of the pulse. And you want, if the baby's awake, the pulse will be around 120 to 160 beats per minute. And now I'm gonna assess his respirations, and I'm gonna count them for a solid minute while I also listen to the lung sounds. And I want to hear clear sounds bilaterally, and if there's any sloshing or fluid in the lungs, that would be abnormal, and it would show that the baby's lungs are not fully matured. After getting respirations and heart sounds, I'm going to assess his temperature, and I'm going to do that with the axillary method. So I'm going to put the thermometer in his armpit and hold it there, then get a temperature. And for a fetus, you want the temperature to stay around 98 degrees Fahrenheit. That's ideal. And then, since I already have him on my crib-like structure, I'm gonna pretend this is also the weighing thing. So I'm gonna weigh my baby, and usually babies are between 3,000 and 4,000 pounds. If they're outside of that, then they're either small or large for gestational age. And so we're just gonna say this one's average for gestational age, and he's about 3,500 grams. Now I'm gonna, since I have the weight and the vitals, I'm gonna do the length of the baby. And babies tend to be on normal about 18 to 22 inches. So don't expect any crazy numbers here. And while I have my tape measure out, I'm gonna do the size of his head, his chest, and abdomen. And I believe that's good for measuring. And now I'm going to do a general assessment of his skin. It's matching his ethnicity. Skin sugar is good, has good recoil. The texture is dry right after labor. There's a little bit of peeling on his hands and his feet. And then you want to assess for lanugo. And my newborn patient was actually Hispanic, so she had a bunch of lanugo. As you can tell, this baby is covered in it. And then, as well as, I don't see any present rashes, a little bit of bruising on the head, and then no Mongolian spots are noted on the rear. Vernix is still present, especially in the neck folds and the hip folds. I'm going to assess reflexes. I'm going to begin with the blink reflex and see if he reacts to light. He does. I'm going to check his responsiveness. He's able to follow a moving object. Throughout the assessment, I'm going to try and do the startle reflex, and I'm going to be looking for symmetrical movement in his reaction, as well as his rooting and sucking. So I'm going to see if he instinctively sucks on my finger, and while he's doing that, I'm going to feel the hard palate and the soft palate. So just moving my finger around, seeing if he has that reflex, which helps promote proper breastfeeding. That palmar grasp, I'm going to stroke his palm and see if he grabs my finger. Same thing with his feet. I'm going to stroke the bottom of his feet and see if his toes react. I'm going to check if you turn his neck one way, that is extremities turn in the direction you're turning his neck. So, and that's the tonic neck reflex. And then the prone crawl, I'm going to put him prone and see if he makes an effort to move on over. And while he's doing this, I'm going to assess the spine for it being straight. I'm going to feel the pelvic bones. And the pelvic bones are symmetrical and present. Now I'm going to move to the head, and the head, it has all his eyes, nose, ears, and mouth. They're in proper, they're symmetric, and they're in proper alignment. In the face, I'm going to assess for any molding, any bruises or scarring, and I'm going to feel for the fontanelle, which will make it really evident if there is molding, because you'll feel them moved on top of each other. And then if there's any abnormal shape, assess it, try and palpate it, but and make your assessment of whether if it's blood or fluid. So if you know you're working with a cephalohematoma and a caput suca. I can never say the fluid ones. I just call it a caput. And then so after the head, I'm gonna assess his facial features already, but more thoroughly. General appearance, if there is any forceps or vacuum assistance, look for any scarring or bruising or forceps marks. And then if he has any tiny papules present, they're going to be called malii, and they will disappear, but they're common in many babies, so it's not an abnormal finding. And now I'm going to do the mouth. I already checked the hard palate, and I'm just going to have him open his mouth, assess his tongue, see that the airway is patent. I'm going to move to his nose, check that the nares are patent and open, and they're not inflamed, nothing's obstructing them, and that there's no discharge either. The eyes, we already assessed the reflexes, but I'm going to look at the eyelids, see if they're in proper shape, proper alignment, see if he reacts to stimulus, and the color of his eyes. I'm going to assess if there's any redness in the sclera. His ears, I'm going to feel for any skin tags, because that could warrant internal problems with development. And then I'm also going to do the cartilage reflex to see if his ears bounce back, and that signifies a full-term baby. The nose is clear. I'm going to assess the neck. There's vernix located in the neck. I'm going to go down. I'm going to feel his clavicle, because labor trauma can end up breaking the baby's clavicle, especially if he gets stuck and where his shoulders can't come out. Sometimes that's the only way. Gonna palpate all along the clavicles, feel for any abnormalities or fractures. The chest, you're gonna observe expansion and retraction of his lungs. Already listened to breath sounds. And then breast is a great way of assessing his food storage, how much meat he's got. So you're gonna palpate the breast and see. It's almost on a good full-term baby, it's almost gonna be like +2 pitting edema. The abdomen, you're gonna assess the umbilical cord, and you're gonna assess for 2 arteries and 1 vein. If that isn't the case, then there could be major complications that happened during fetal circulation. And then as well as the femoral pulse, and the pulse on his left leg because of fetal adaptations. Assesses inguinal area. Palpate for any lymph nodes. Lymph nodes should not be palpable. Extremities, you're going to assess if his arms are of equal length. His legs are of equal length. And a cool note I found was that right after birth, the baby's arms are going to be longer than your legs. Baby's got all his fingers and toes. I'm going to assess the creases in his hands, creases in his feet. Get a little range of motion with the legs going. You want the hips to abduct at an angle greater than 60 degrees. Assess for jaundice, which the clinical manifestations being the yellowing of the baby, blanching skin, and a high bilirubin lab value will confirm it. And then what am I? Bowel movements. Bowel movements and voiding. You're gonna want to see the first bowel movement. Expect a black tarry bowel. That's gonna be meconium, and it should happen within the first day after labor. And same with voiding. If the baby doesn't void for the first day, the most likely are complications. And when you're assessing the urine, you want to look for any abnormal color and any odor that is foul or noxious. And my baby bear is a boy, so I'm going to assess the penis. And then if he has a circumcision, I might want to make sure it's dry and bandaged and clean. Assess that it's all there. The scrotum, the testes, look at the rugae on the scrotum. Palpate for 2 testes. Keep it clean. The butt, you want to assess that they're symmetric, the hips, that the colon is patent and clear. And then during your assessment, you can assess for pain by looking for any signs or symptoms. For babies, the biggest sign and symptom of pain I can think of is high pitched crying. High pitched crying indicates that there's something wrong with the baby. And I think that was it. And we're looking at a very healthy baby boy. Sorry about the lateness. Thank you for your understanding, and I'm glad I could finally turn everything in.